So I'm going to give you a quick tutorial on how the 3D pelvis should work, or how the hip should work in sort of a 3D motion. Now, in the golf swing, most people understand the pelvis as its main role of just rotating or turning, okay? Now, in our lessons, we see a lot of people that their sole sort of purpose of the pelvis is to really wind that pelvis up as much as they physically can. Now, if you looked on our gear system, the average tour pro will only rotate his pelvis about 35 to 45 degrees of turn. Now, when you look at that, that's actually, in effect, it's not that much. So it's only minimal amounts of turn this side, because what we want is symmetry. We want 45 degrees of rotation in your backswing, 45 in your downswing or impact. Now, if we are rotating at 75 to 80 on the way back, which some people do because they feel that's more powerful, there's no way you're getting that pelvis to beyond 10 degrees open at impact, because there's only about a 75 degree range that you can physically move your pelvis in that amount of time. Now, we also see sort of massive spins of the pelvis, so where the pelvis just rotates and there's no load of the right pelvis, load of the right hip at all. So this brings into play the other two parts of the equation when you're just looking at rotation. So you've got rotation, you've got forward bend, and you've also got tilt or side bend, okay? Now, all of these have to be matched up to give you the right amount of turn, the right amount of tilt, okay? So at address, what we would be looking for is for the pelvis to sit with about 20 degrees of forward bend, okay? So you're tilting forward from the pelvis. What we definitely don't want to happen is a sink into the knees and the pelvis to be very flat. We always want that pelvis to be tipped forward just subtly, okay? Now, what this does, this allows, as we make our pivot, the right hip to work higher than the left hip. Now, what we can see here is that I'm starting with give or take 20 degrees of knee flex. Now, as that right hip is going up, the right knee may lose a couple degrees, but as the right hip goes up, the left hip goes down, and in turn, that left knee will increase in flex. So most of the time, that left knee will start at give or take 20 and will double to 40. Now, what this does, this allows us to pivot but also not over rotate, because if the pelvis is in the right tilt and the right side bend, we can't over rotate that pelvis. If we haven't got the right tilts and when we're very flat with the pelvis, there's no tilt at all, that pelvis will really over rotate, it will spin. It will make it very difficult to create any downward force in the downswing impact. It would also make it very difficult to keep the club on plane during the way back. This is what we see a lot of times when the club gets very inside. It's normally because there's excess rotation very early and not enough side tilt, okay, or right hip raising, left hip lowering. That right hip going up, left hip going down allows the club to be pitched on the right plane as opposed to really flat. Now, what this also does, this puts us in a position where the pelvis is in effect in like a downhill position. So the left hip is lower than the right, making it much easier to shift our pressure into our lead foot on the way down. So we want to make a very subtle little fall onto that left foot. Now, what that is going to allow us to do is to load that lead side, ready to use the extension of the left knee, left hip, left ankle to shallow out down at the bottom and use our vertical force. So the first movement is a tip, then we're going up. Now, it's very difficult to do if the pelvis is just spinning. We can't make a fall. It's always a big excessive rotation, okay? Just as a quick guide, if you're looking in 3D, when the pelvis returns to zero in terms of rotation on the way down, that's when we want the side bends to match up, okay? And when the side bend gets to zero, we don't want that happening too quick. The hands should be about waist height. So then we're ready loaded into the lead side, ready to push out of that left foot, okay? So we don't want that left hip kicking forwards loads. You don't want that left hip getting very, very up very early, because all that's going to do is going to move the low point way back. So if you're someone who struggles with excessive rotation of the pelvis and you just over rotate. If you're someone who gets the club very inside on the way back, just check that your pelvis is first of all bent in the right spot, okay, that we've got some tilt from the pelvis, some bend forward, and that right hip is raising, left hip is lowering, left knee is lowering, right knee is extending marginally. That will create some nice side bend and make it much easier to fall onto the lead foot and create some compression. A really easy way to check this is to place an alignment rod, make sure it's nice and flat across through your bout loops, so it's nice and level. Okay, now we want to try and feel first of all that we get into that good tilt with the posture, okay, and the pelvis. Now, as we are making our backswing, we want to feel like this right side, this right rod, is going to raise slightly, whilst the left rod lowers slightly. Now, we don't want excessive, and we don't want this left knee to pressure too early. We don't want to get the pressure into the lead foot too quickly, but we want that right hip going up slightly, so it's risen slightly, okay, that would be level, that's up, so it's going to be about 10 degrees of tilt, okay, and as we transition, we want to feel like that the left rod stays down in early transition, okay. What we don't want is a really good backswing position and then the left hip rising very quickly. That would make us move low point back, be very difficult to create any compression. It's a massive power leak as well, so we want to make sure that as we're transitioning, left hip stays down, the rotation will return to about 0. That's when the hip should level out. You can do this in a mirror, you can set your phone up from a face-on position, or you can literally just do it static, just to get the feeling of how the pelvis should tilt and rotate. You can see here, that's about as much range of motion as I've got. In terms of rotation, that's probably about 40 degrees of turn. To create that over rotation, I'd have to turn everything really flat, that throws my balance off. And again, there's no way I'm getting that left hip down through the golf ball. So right hip nice and high, fall, keep the left rod down.